Hello, Dr. Sean here. When we think of silent organs, the liver usually comes to mind first. But pancreas is also one of those silent organs. Remember how Steve Jobs passed away from pancreatic cancer? Even someone as prominent as Steve Jobs couldn't detect pancreatic cancer early. We're the one who knows our bodies best, right? It would be great if we could quickly recognize the signals from our bodies when there's an issue with the pancreas. So today, I'm going to tell you about 6 signals that indicate a problem with the pancreas. Please make sure to pay attention and remember them. Let's get started. There can be numerous diseases associated with the pancreas, but to simplify, there are a few distinct ones. Acute pancreatitis, which is inflammation in the pancreas, and chronic pancreatitis. The second category is a cystic disease of pancreas. And then there is most concerning one, pancreatic cancer. The pancreas serves as a both digestive organ and endocrine gland. However, to keep the video concise, let me skip the physiological part and move directly to the symptoms. Just remember the location of pancreas. The first symptom is abdominal pain. Abdominal pain is more common in case of inflammation than in case of pancreatic cancer. It is also more frequent in acute cases rather than chronic ones. A characteristic feature is that the abdominal pain radiates to the back and sometimes to the shoulder. If you experience such pain, it is worth considering the possibility of pancreatitis. In the case of acute pancreatitis, the pain typically lasts for 6 to 24 hours, and it is severe, making it difficult to lay down flat. Leaning forward like this slightly can provide some relief. In chronic cases, pain usually comes 1 or 2 hours after eating, then subsides, particularly worsening after having greasy food or alcohol. As for pancreatic cancer, there are typically no symptoms in the early stage. However, as the cancer progresses, you will naturally begin to feel pain, indicating that pancreatic cancer has advanced. The second symptom is indigestion. Even if you use a prescription digestive medicine, persistent indigestion without improving for a long time could be due to lack of pancreatic enzyme for digestion. This is more likely to happen in case of a chronic pancreatic insufficiency, which is usually caused by chronic pancreatitis or pancreatic cancer. However, it is rare in the case of acute pancreatitis. Pancreatic enzymes play a crucial role in the digestion of fatty foods. When pancreatic function is compromised, you may experience discomfort, especially after you eat fatty food. Additionally, undigested fat oil may appear in your stool due to the incomplete digestion of cholesterol. So, if you experience indigestion along with the oily stool, it is advisable to consider the possibility of problem with the pancreas. The third symptom is loss of appetite and weight loss. In fact, this is a common symptom that can be observed in many different types of cancers. Cancer cells consume considerably higher amount of calories in the body compared to normal cells. As a result, when cancer develops, the body spends more calories, leading to eventually weight loss. Typically, in such cases, the loss of appetite also happens. The fourth symptom is abnormal glucose levels. If the body suddenly produces less insulin, it can cause abnormal glucose levels, which might suggest there is a problem with your pancreas. If you have no family or personal history of diabetes, but it appears suddenly after the age of 50, also if you're taking medication for diabetes and suddenly cannot control your blood sugar levels, it's important to consider pancreatic disease such as pancreatic cancer. I have a study I want to mention related to weight loss and abnormal glucose level I just talked about. It's the latest paper published in 2022. The paper found that among patients diagnosed with pancreatic cancer, those who experienced continuous abnormal blood sugar and weight loss over the past 2 or 3 years were identified as a risk factor. So please remember weight loss and glucose level. The fifth symptom is jaundice. Not all pancreatic cancer causes jaundice, but it is still possible. In cases where the tumor develops in the head of pancreas, if it blocks or compresses the pathway for bile to flow from the gallbladder to the small intestine, bile can accumulate in the body, leading to jaundice. The sixth symptom is the stool color. Typically, we see dark brown stools, right? We see this color because of the presence of bile. As I mentioned earlier, if bile doesn't properly make its way to intestine and doesn't mix with the stool, it can result in light-colored or gray stools instead of usual brown. The symptoms I have just discussed may be caused by conditions other than pancreatic issues. But pancreatic cancer is particularly concerning because if it's not detected early, it can spread more quickly than other cancer. And the prognosis is often poor, so if you experience any of these symptoms for extended period of time, I strongly recommend visiting a doctor for a thorough examination. Also, pancreatic cancer is one of the cancer with a genetic predisposition. So, it is also essential to consider the possibility of pancreatic cancer if there is a family history of a pancreatic problem. If a first-degree relative was diagnosed with pancreatic cancer before the age of 50, or if there are 2 or more cases of a pancreatic cancer in the family, regardless of age, it is important to be aware of the risk. How was today's video? If you found this video helpful, please like and subscribe to the channel. I will come back with other helpful tips. Until then, stay healthy.